Yes. So next time, I'm sure what
Yes.
I'm sure what to do. Okay. So basically, the topic really today is very
Mhm.
simple. We want just to look briefly at how coronavirus has really caused chaos, throughout Europe. Even in Europe right now, they're still asking themselves what to do. But now, just imagine if this thing is happening in Africa and they're having these problems. Imagine, no, I mean in Europe.
Mhm.
Imagine how is Africa coping? Because we know sometimes of the infrastructure and stuff like that, because what you see from on social media, it does not really encourage. It doesn't really show that we are yet there yet in terms of organizing ourselves. What do you think?
Um, yeah, I have been following this issue because it's really a global issue. It's pandemic issue. It's a public health issue as well. So it's really widely affecting people throughout the world, including uh, regardless the level of growth and economic development, both
Yeah.
global south and global north. I think everybody, every country, everyone is being affected by this really pandemic, global pandemic issue. Uh, Coming to Africa, I can really imagine how these countries can really be impacted by this kind of global issue. So for me, it's a matter of a lot of aspects. I can say from the point of institutional capacity, financial capacity, and the ability to work in a synergy. We see now, but we don't see, for instance, the African Union, the role of African Union. What is African Union? I don't see any kind of continuous updates about this issue across Africa.
Okay. So
So I really
before,
okay.
yeah,
Mm,
before you go ahead,
mhm.
David Otto he's got an agency. It's called Global Risk International. In fact, he deals into with security and you guys, because you're gonna discuss this one on an intellectual level because you understand. You have been in Ethiopia, you've been in Somalia, you've been in Sudan, and David, meet
Yes.
Bereket. Bereket is, in fact, we might as well start calling him Dr. Bereket because he has just and his
Uh,
PhD. Yes. So
Saying Barakat would be okay. Okay.
Bereket, yeah. So David is also very, very well versed in these matters of security issues. So you see, many people in Africa, how they understand security, they think that when a country is invaded, that's when they start thinking about security. So now you can see this global catastrophe has kicked in, and it's like, I don't know really. I don't even know where to start. I don't know whether to criticize them. I don't know what to do to say about Africa. But you have just said a very important thing here. Where is the African Union? So David, Bereket, have a conversation. I'm going to be listening to whatever you're saying.
Thank you very much, Mr. Joseph. And Bereket, it's a pleasure to have this conversation with you.
Thank you.
As you can see, first of all, the impact of this global pandemic is the fact that we are now all working from home. And that can tell you from the various backgrounds that we are using, on this Zoom platform. It tells you the severity of this pandemic. And as Joseph Adamson had said just now, we are looking at what you call, in security terms, human security impact here. Yes, this is a health pandemic, which we all know it began in China, in the city of Wuhan, and now the virus, coronavirus, as it's called, COVID-19. In terms of its strand. We now know it's spreading. and across, the continent. And of course, as you rightly said, in your statement, Africa is where, we are thinking about how is Africa going to cope? Because this is not a war where, one country in Europe or the United Nations would come and say, we are going to help Africa, or where the United States would say, everybody's beard is on fire, as this Africa traditional saying goes. And that means, each and every country would have to depend on the systems that it has built before. New systems are not going to work because, the pandemic is here. So it means that, African governments, have to be able to start thinking about what the security impact will be. I mean, besides the health impact, what is it that is going to impact on the security? And my first concern is looking at it from a point of, yes, the next step that these governments would take is that they would have a shutdown, a lockdown of, the most common places where people would go to, like, we have here in the UK now. Nobody's allowed to go out anywhere. But when you have a system in place, to look after people, a system where people can maybe order food, something simple as that, a system where people can be looked after. Here in the UK, the government has proposed to pay 80% of salaries. Would that be the same? They are looking after the self-employed. Of course, there are caveats to that. So our biggest concern now, my friend, I don't know how we're going to, what you think. How is Africa going to be able to deal with this? Because no country is going to go and help any country. It's a global pandemic. Everybody has to deal with it within their states. How is Africa going to cope with the huge incapacity in terms of their health systems, with bad governance structures, with corruption, and with a population that is not very familiar with order? So I don't know how you think we should look at these angles, and what do you think? But I think it's quite bleak, from my point of view. The most Africans that I've spoken to, they are not taking this seriously. They think, this is a white man's disease. And, there has been rumors that it doesn't affect African people, but that is wrong. It's not scientifically proven. So how do you think we can move forward with this, Bereket?
I think we can see from multiple angles the issue. Like you said, it's not really any kind of health issue, but basically it's like has got a wider impact, particularly looking from the economic point of view, political point of view, the role of leadership. We can talk about the role of leadership as well, because I can see every leader of a country is now available always, or being given a briefing, daily briefing. So I can see it's like has got a political dimension, economic dimension, health dimension. So it's really a wider issue. Honestly, I was not really expecting to have this kind of pandemic health issue, because my expectation was like thinking about the cyber attack, cyber war, all these things, So nobody was talking really about this level of magnitude pandemic. So for me, it's become really global. We have seen like these similar ones during during the 20th century. But the level of transportation, the level of flight connections nowadays of globalization. So the impact now really is of its highest magnitude. So if there is a health issue in one place, it's very difficult really to talk about a kind of localized issue. So it's really a global issue. Coming to Africa, I can see, the level of capacity of these countries really differ. It's very difficult to talk about Africa as one really cohesive state or continent, because their level of capacity, their level of communication and also connections globally differ. For instance, I was looking at the statistics, and Egypt and South Africa, I think, were leading in terms of being affected by this disease. But others were a bit reluctant in terms of intervention. Like you said, there was a saying, okay, Africa is really a kind of safe place. At that time, I was in Uganda. So people were talking about whether the weather can really affect it or not, or is the kind of food Africans eat. So there was a kind of myth or rumor saying that Africa might be in a better position really to not expose to this kind of global pandemic. However, now it comes to the stay-at-home policy. Most of these countries now are introducing different levels of the stay-at-home policy. But like you said, here in the UK, we have got like a social security system where a government can really intervene, cover the salary of 80% of the salary of the employees, and also about 95% of the self-employed might also benefit from similar kind of scheme. And however,
Let me invite you again. Go ahead, guys. Okay. Keep going.
Okay, so in terms of Africa, the issue remains.
Yeah, it started. It is started already.
You said 9:30, man.
I know it is. I made a mistake somehow, somewhere. So yeah.
Okay, let me join it.
Yeah.
I'm waiting for the time.
No, if you're still in, try to follow that link. Okay, guys.
Yes,
I just want to jump in just quickly. What I see is that Africa is not learning from past experiences. You know, Africa is being hit by Ebola, and that actually went with the aid from the West and stuff like that. Ebola in Congo and Sierra Leone was somehow contained. But as you pose the question, where is the African Union? In fact, now it is the African Union which should come together and say, well, look, this is really what we need. This is what is needed to happen. We need to happen. Say, for example, look, Britain, they have already put in 300 and whatever billion. America, they are talking about 1 trillion. But we cannot actually compare that. But if Africa together, they could actually have a couple of millions of dollars to cope with this thing. And in fact, right now we are at the mercy of coronavirus because it hasn't really hit as much as it has hit Italy and stuff. I just want you guys just to touch on this idea. Why is Africa not learning from past experience?
I understand. I totally get your point. And you make a very, very strong point there, Mr. Joseph. But as Bereket said, you know, Africa, yes, is one continent, but you have different countries with different capacities that can respond or contain this virus. But if we look at, you know, the most vulnerable countries in Africa, which, you know, perhaps I would say would be towards the central region of Africa, the western region, the West Africa and East Africa, you would see that there is an issue there of capacity, you know, which, as you rightly say, most of these countries on their own, you know, may not be able to respond effectively to the spread of the coronavirus. And, you know, they would probably not be able to contain it because they don't have the equipment, they don't have the required expertise, the required medical personnel to do that. So these are the kind of countries which I believe the African Union can assist. Mind you, when you're dealing with a global pandemic of this nature, each country becomes insular, you know. So even though you have the African Union as a body, you still have the interests of member states, which is premium to the help of any other country. So the African Union would really have to struggle to gather enough support and enough finances to be able to actually help, you know. But again, you know, it comes down to planning and preparation. My last conversation that I had with a gentleman from the African Union about this, about precautions that can be taken, he believes that the African Union is doing what it can do in terms of sensitization. But the truth is that the African Union does not have the kind of capacity that they need in order for them to help each member state. Because again, in my opinion, and that is scientifically proven, the way this disease is spreading, it's very difficult for one country to say, we don't have it, or we have very little cases. I mean, my concern is, from a medical point of view, which, of course, I'm not a doctor or anything, but, most countries in Africa have this virus, but the level of testing is weak in Europe. But it's a disaster. It is in Africa. So we are in for a really, difficult time. So I don't know what Bereket thinks, about this.
I think you are raising a very relevant point in terms of dealing with the consequences of this disease. Basically, I can say in terms of, the solution being suggested is very classic. Stay at home, close borders, stop any kind of flights or any kind of flights or connections. Yeah. So the solution being suggested is very classic for me. But the main capacity and policy issue will be mainly on dealing with the expansion of this disease. How you can really contain. For instance, in one country, you may have 1 or 2 up to 10 people. But you see this number is being multiplied, like most of them they suggest, usually multiplied by 10 in terms of rate. So you can see the magnitude of its impact in terms of expanding, in terms of the state's capacity to contain it. So here we can say, do we have enough ventilators? Do we have enough staff, medical staff to deal with that? Do we have really enough contingency budget to deal with this kind of emergencies? So, we can really review in terms of state financial capacity, state institutional and police capacity, and in terms of quick delivery of services. It's not like, okay, I can now plan and then I can implement this one in several years to come. But this is like the emergency. Yeah, it's emergency. So so it's like kind of a fire brigade. Something is burning now, or just have a fire. You need really to deal with that.
Okay, so guys. Let me introduce to you another guest. This is from Kigali. Ignitius, can you hear us? I think it's maybe because of the connection. Continue.
Yes, so just to finish my point, so I can see really it's kind of capacity issue on these countries, but there should be also kind of, I was thinking about at African Union level. African Union, like what the WHO is doing now, should really be very proactive in terms of dealing with the disease, in terms of also trying to support these countries. So the next question comes that, what will happen now? People are staying at home. Do governments will provide them any kind of social safety net? Will they provide them food? Or will they be left to their own social capital approach to deal or to support each other? So we can really think about what can happen, how the states or the society in Africa can really respond at community level or at state level to this kind of impact and its own negative consequences.
Bereket, guys, let me. I can see we have got Ignitius from Kigali, but I'm not sure whether he can actually hear us. Ignitius, can you hear us?
Yeah, I can hear you. Yeah, fantastic. I can hear you, JJ.
Fantastic. Now, what do you need to? Fantastic. Now, what you need to do? Tilt your phone so that we can see more of your face.
I want to see more of my face.
Yeah. Now we are seeing the ceiling. Bring it down. Bring it down again. And again, bring it down. Yeah,
Better now.
No, it has swung. Okay, now this is better. This is better. Okay, guys, I want to introduce to you Ignitius from Kigali. He's a businessman, and he's the man also. He's well versed in security matters. This is the man who introduced fire services in Rwanda. So you have got Bereket. He's Dr. Bereket. He's just earned his PhD, very well in social issues. And then we have got David Otto from Global Risk International. Basically, what we are discussing here, we are discussing how is Africa handling coronavirus mayhem. So I know you have missed quite a bit. They can actually summarize what they have said, and then you can add on. Let us continue with Bereket. Summarize what you think about the role of UN, for example. No, not UN, African Union.
The African Union.
Yeah.
So I think I can give you briefly, I mean, some notice what we have discussed.
Yeah.
We discussed about is the impact of this COVID-19 at global level, at Africa level. How the capacity of these states in Africa differ in terms of handling the issue, in terms of being proactive, and also dealing with emergent situations. So I think we have tried to explore the overall situation, but I think we can also share us from Rwanda's experience how the Rwandese government is trying to deal with it, how the society or the community, the Rwandans are trying to deal with the issue. So I think if you can really share us with a kind of first-hand information, that would be great.
Yeah, and thanks for for joining from Rwanda. My point has always been that this global pandemic, from the way it is going and the various capacities that most of our African countries have and do not have, there is a potential that we can see the emergence of what I refer to as a COVID-19 revolution, which is possibly much more worse than the Arab Spring that swept North Africa and the Middle East. But this time, it's going to be a revolution that is going to be caused by lack of basic necessities, by people who will be forced eventually to go towards a lockdown and stay-at-home mood. So I am very concerned about the security impact. We are already seeing these signs in Italy, where some people are already rioting. We are already seeing that the government in Europe are they are expanding on the time that people would stay at home. And mind you, we have a relatively good system in Europe. So if we come back to some of the African countries where governments do not have the capacity and as Dr. Bereket said, some of the logistics to deal with this pandemic, don't you think that there is a possibility that we could be faced with not just the global pandemic of COVID-19, but what I refer to again as the COVID-19 revolution?
Ignitius, let us hear your thoughts. Yeah, probably there is a lag. Ignitius, are you with us?
I think there's a delay.
Yeah. Okay, yeah. Ignitius, if you are there, we would just like to hear what your thoughts are, because in Rwanda I just saw some again, social media. You've got different ideas coming from social media, people taking pictures and labeling it totally different things. So but Rwanda seems to be, Kagame seems to be following, I don't know whether it is the advice from the West or he's learning from the West, because when you what you see how he's handling the food situation and is distributing food everywhere, which is not okay, which is not really happening anywhere else. So let me share this thought, this idea. I think his Ignitius's phone is dropped out. But okay, this is what has been happening. In Uganda, say for example, if you are a Ugandan and you are going back home, what is likely to happen when you go to the airport? You are told you have to stay, you have to go to quarantine basically for 14 days.
14 days.
And that 14 days is you have to pay for it. And it is the airport have to select the hotel that where you're going to stay. So do you see how other governments are actually, I don't know whether it is the workers or governments collaborating with the hotels. Even it is happening in Kenya. In Kenya, I just saw something on social media, which I cannot even verify. People are asked to pay $1,200. That is for 10 days. And you have to pay a deposit of 6,000. Whereas other nations, other European countries, they are putting the money to support those who are vulnerable.
I think you're making a very powerful point here, Joseph. I think the first point of acknowledgement is that there has been a proliferation of misinformation about the COVID-19 itself. There's been a misinformation and proliferation of information about how governments are dealing with this. You're correct that some governments, because of the lack of experience in dealing with biological pandemics of this nature, they're trying different measures, which some of them, are quite, concerning. Yes, you previously mentioned Rwanda, and one of the things which I have learned from visiting Rwanda and meeting a lot of the stakeholders is the fact that, like every other country, what you put in is what you get out. There is a system in place already in Rwanda which works well for the people, and because there is a system in place, it is a lot more easier for the government to establish a database of its citizens, and it's a lot more easier for the government to distribute any kind of assistance in events like this. So the situation in Rwanda, as Dr. Bereket had said earlier on, tells you that each African country has its own, infrastructural capabilities, which makes it much more equipped or ill-equipped to deal with this phenomenon. Now, what is happening in Uganda, and I've seen the same in other countries, is that where there is chaos, there is opportunity. And, there are certain measures which some of the governments or ministries are putting in place, which, are outrightly discriminatory, but also they are profiteering in the sense that people are being exploited. And this is where we really have to watch out for impact of grievances of this nature, which may, in my opinion, will accelerate any events that that could lead to a total disorder. So I think this is where my concern is, how the African governments are managing this pandemic, and sooner or later you would find that people will take matters into their hands, because it will become survival of the fittest, and this is where my concern is. I don't know what Dr. Bereket thinks about this.
I think JJ, you are trying to pick this very important issue, because I was able to hear from my friend. She was planning to travel to Ethiopia, and when she arrived at the airport, Heathrow, she was advised saying that if you go to Ethiopia, you are going to stay in the quarantine for 14 days, which she had to pay the money. So it's very difficult for an individual, especially from low-income family household, to afford any kind of these 14 days quarantine expenses. It's really in thousands of dollars. So I think the government can really have two perspectives or two dimensions in terms of how governments can deal with this situation. If a person prefers to have a 5-star hotel or like a high standard hotel, they can really have one kind of hotel for them where they can really quarantine there. For people who are really low income or who don't have really an income at all, I mean, who don't have really the money to afford to cover 14 days hotel expenses, they should have really a makeshift or like a temporary medical center where they can really stay and also just finish their 14 days. So I think it's like a very difficult approach the governments are taking. It's not really concerning, or it's not really considering those are really low-income families. So it's really, the government should really consider this as a kind of very important matter, because people cannot really have, I mean, some of them, they are not really going for a luxury. They are not tourists. They are trying to do something.
We seem to have Ignitius back. Let us see if we can actually maybe get a word, maybe or two from him. Ignitius, are you there? Can you hear us? I know there is a delay. We will keep talking. If you can hear what we are saying, you will raise up your hand, and then I can come to you. Hello, Ignitius? Okay, I think it's a connection. It's a problem. Right. You know, this is what I am going maybe to suggest. Okay, it's gone again. What do you think? If the African Union is unable or incapable of dealing with these matters, do you really think the UN might come in and intervene in whatever is going on? Because you see, as Africans, we are always thinking about making money. We are not actually let me say this. This is an observation. This is not a criticism. Because, you know, once you point out something that is going on in Africa, they will say you are criticizing. No, we are not really criticizing. This is an observation. Because I didn't think that in Ethiopia they would behave like so. So most governments in Africa are not thinking about their people. They're about how to make money. And mind you, this is how I say it. African governments are going to lose a lot. Because if they're going to follow this bandwagon that, okay, let us ban all planes not to come into Ethiopia or Kenya or Uganda. We do not have industries. We only rely on tourism. Say, for example, if they lock down or they stop all planes coming to Uganda or Kenya, even if it's only for 2 weeks, believe me, the economy is going to suffer very, very, very bad, because they are relying on tourism. Now, this money they think they can get from their fellow citizens who are coming to visit their family maybe for 1 month, and then you are taking away all the money that they have saved to come and give to their families. But who is advising these African governments? Do you have any idea?
I personally, I think that the African Union must have a disaster recovery unit. Part of the World Health Organization should be liaising with such a unit in terms of looking at how they can respond to this kind of pandemic. But how effective that unit is, how equipped they are, is another question. And I'm glad that you asked about the UN. because the UN has already been very proactive in asking for 2 billion for a start, and this money, according to the UN, would go to the most vulnerable countries, and I'm sure that Africa will be at the top of the list. My expectation would have been for the African Union to request for that kind of help, because what we should be doing at this point in time is for each organization to look after its members, and the African Union is well placed, in my opinion, to coordinate any emergencies, any logistics, any kind of capacities for African governments to tackle this phenomenon. But Mr. Joseph, I don't think this is the case, because right now, even the Secretariat of the African Union is not holding. Of course, this is a matter of keeping your distance. But trust me, I don't see any role here that the African Union is practically playing. But hopefully, we can see some changes. Hopefully, they can come around and learn some lessons. But I don't know, Dr. Bereket, I don't know what your opinion is. But
we have got Ignitius online again.
Yeah,
so,
I'm back.
Fantastic.
I'm back. Sorry.
Good.
Sorry, I had an issue with my network, but I think it's sorted now. Sorry about that.
Now, okay. We have spoken about so many things, and also we touched on how African countries are handling this coronavirus mayhem. But there is something good happening in Rwanda. Just tell us what is exactly, how is Rwanda handling this issue? From your own.
Yeah. Thank you, Judge. And hi, how are you, everyone? Hi, David. Hi, Bereket. I mean, Rwanda acted very, very early, before we even had a single case. Rwanda instituted measures that were aimed at preventing the virus. I came in from London on the 11th of March, and the testing had already started. But even the other measures had started before. So we came in at the airport, there was a testing machine, and we were suddenly tested and allowed to enter. A few days later, after we had a single case, just one case, all the people who came in were quarantined until they were tested. So a week later, which was from last week, there were no airlines going in and out, coming in and going out of Rwanda. The borders, the land and water borders were closed, and social distancing was enforced. And there is, as you know, there's a lot, and that seems to have helped to reduce the cases of coronavirus spreading. So I think it's about discipline. It's about acting very early, but it's also about the discipline. Within the people, the population.
But you see, Rwanda, the way how I see, Rwanda seems to be learning. It is the only country in Africa which is actually learning and which is almost following international order. Now, well, look, people might disagree with me, but I have no political affiliation. I don't like politicians, but when I see something's happening somewhere in a country, I feel it is okay sometimes just to say things as it is. Now, what we have been discussing here in Uganda, what is happening, or in Kenya and Ethiopia, when citizens are going back, they are stopped at the airport, and they are asked to pay money. They are asked to pay bills to the hotels. I'm sure in Rwanda it's not happening. Is that? Is it? Do you really something like this?
Facility.
Yeah.
The government. In Rwanda, the government has set up a facility outside. We beat outside Kigali, outside the capital city.
Yeah.
So whoever is found to be with coronavirus is taken there for care, and for treatment. And the government is footing all the bills. And the people who are quarantined before they are tested, they're also taken care of by the government. So there's such a thing as paying for anything. The government caters for everything.
Hello, JJ. Sorry.
Yeah,
no
that's
problem.
the difference.
Yeah.
I think that's the difference with other countries. Because when you tell people to pay for themselves, when you tell people to pay for their own care, then there's also a question of people trying to avoid it. They try to avoid paying, and they try to sneak in and hide, and so I mean, somebody's coming in, and it's a public health issue, and you're telling them to pay for it. They didn't prepare for that. So what has been happening in other countries, especially African countries, people just hide. They try to find their way out into the community and just disappear.
Okay, it's been good that you have been able to join us, actually. What we are going to do is that we are going each one of you is going to just give at least 1 minute of their thoughts. This is about solution finding. You see, already in Rwanda, we know we have got a solution there. So let us start with Dr. Bereket. What do you think, solution finding? How can we go about this, actually correct the badness, at least to follow the example of Rwanda?
Okay, maybe I didn't follow the Rwanda's case, but I just want to make a point on what you said, JJ, before, or earlier, about the governments are trying to get profit from this kind of disease. I wouldn't really say they are getting profit from this kind of disease, but they are trying to avoid their own responsibility or taking their own responsibility. Rather than they are trying to avoid that responsibility and then give to the hotels, where the hotels are trying to exploit them. So I think the model should be revised where the government can have really a responsibility for everyone. In regards to the solution, it's really, the countries are taking their own way of following the WHO, trying to contain themselves from any kind of external expansion of this disease in terms of trying to dealing with the patients. So they are trying to make their own approaches. But thinking about the economic aspect of their intervention, now I can say they need really immediate intervention to support those who are really poor householders, or they cannot really afford food and subsistence. So the government should really design a way how a daily food should really get or reach to these families. That's one issue. So does the government have the capacity to really feed people in their own countries? Most of them, they really live from hand to mouth or from what they get daily. If someone stops working on daily basis, and then what will happen? There is no food for that family. So in this case, the government really think now how immediate emergency situation can be dealt with, what kind of approach. So that comes to the money. Does the government have the money to deal with this, or the government is going to look for international financial institutions?
Okay, one minute is over. 1 minute is up. Let us hear David. David, you are from Cameroon. Give us a little bit of any information how Cameroon is dealing with coronavirus.
I think the Cameroon government is using a standard WHO kind of practice, in the sense that people are being told to stay home. People are being told to practice social distances. People are being told to practice some certain hygienic methodologies. But these are advisories rather than people being obliged to do it, because the government does not have the capacity to you know, despite saying that people should stay home, they don't really have the capacity to make sure that people can stay home. So, you know, there are two issues here, Mr. Joseph. One is dealing with the spread of the coronavirus itself. You know, how do you stop the spread of the virus itself, and how do you manage the impact that your strategy of trying to prevent the spread of the virus, how do you manage that impact? How do you manage the people that you've asked to stay at home? How do you actually continuously manage the frontline workers, the health practitioners, you know, with the limited logistics and capacity? So I think from a solution point of view, which I think is very important for us to talk about, is that it is a bit too late for governments to react, you know, to this disease, you know, in a manageable way. So I think what is going to happen now is, you know, we would, you know, the advice is for how do we do what you call damage limitation? Because if you have a system like Rwanda does, or like most most Western countries have, then it's easy for you to manage the system. But if you don't have a system in place, you can't start building one now. You know, good governance is not something you can introduce in the middle of a pandemic. Control measures on containing people is not something you can introduce. You know, Rwanda already has a very robust system. I've just recently been there, so I know. So my thought is that each country has to look at how it can limit the damage, you know, depending on the capacity and capabilities that it has.
Okay, fantastic. So
no countries will help anyone.
Yeah. Final thought to Ignitius. You see, we can actually see, as I said, Rwanda is learning, or it has got best advisors. And if Rwanda has got advisors, that means it's very good at taking advice, because I'm sure many African countries have got advisors too. So final thought, and then we close. But I think we are going to revisit this topic again. This time, I will also be well prepared. You know, as a technician person, I could have lost the job today if I was employed by someone, because things didn't work. So, Ignitius, okay, you are going to close. Take your thought.
Yeah, thank you, Joseph. I mean, to be honest, most of the countries were caught unaware by this. No one was ready for this. But the level of existing organization in every country matters a lot, also in dealing with a situation as abrupt as this. You know, this was very, very abrupt. And as you know, some African governments or some other governments are not always ready. The good thing with Rwanda, you know, it looks like there is always a system in place. I remember the Minister of Health was sacked earlier I think in February, because, you know, when she was questioned about preparedness at that point in time, before even coronavirus reached in Africa, she didn't seem to have a strategy in place. And, you know, she was sacked straight away. And a new one was appointed, and the preparations started in earnest before we had a case, before even coronavirus, you know, had reached here. So I think it's about the existing level of organization in a particular country. In some countries, this level of organization does not exist. Where in Rwanda, it looks like, you know, many things are in place, ready to go into action after whatever happens. So I just want to add that after the Rwandan government enforced lockdown or stay home from Saturday last week, and the government agencies have been going around and giving them food. You know, such a kind of quick action to analyze.
Okay, the line is disappearing.
The needs of the people and be able to say it again.
Okay, the line was actually disappearing, but you have got about a minute. No,
right.
10 seconds to close up.
Yeah, I was just saying the Rwandan government has been able even to feed the people who are not able to feed themselves during this stay-home process. So just it's about organization, existing organization. As David said, you cannot put these things in place when something happens. There must be a level of organization that goes into action when something like this happens abruptly.
It's very good to hear. Gentlemen, it's very good to hear. And by the way, really, thank you very much for actually joining in, because I just put this thing today, and I was sending out invitation maybe within a half an hour, and you said, yes, let's do it. But you see, this quality of discussion, I think we need really to continue with this. And so basically what I would like to hear from you is send me more information and feedback as to what we can actually do. I promise you next time I am going to be prepared. There will be no fiddling about. So, but thank you again. Thank you, Dr. Bereket. Thank you, David from Global Risk International. And thank you from Ignitius Mugabo from Kigali. So you see, we are there. We are collecting information.
Yeah, you tried, Joseph. You tried. You did very well.
My wish is that we want to have a number of academics and intellectuals coming to discuss the issues without pointing fingers. You see, here we have discussed issues. Yeah. We are examining the situation, what is going on. Where we are not biased about any country. As I said, I have no affiliation with any political party, and seriously, I'm not interested. But thank you very much. Should we do it again? Probably by the weekend. We can get more people.
Yeah.
Yeah.
Yeah. Sure.
Thank you.
It's a very hot topic. It's a very hot topic. You should we organize. You know.
Oh, definitely.
Organized.
Definitely. Yeah. I am going to dig up some people and see how we can actually take this further. Thank you very much.
Thank you, gentlemen.
Thank you.
Thank you, guys.
Bye-bye.
Bye.
Thank you. Bye-bye.
Yep. Yeah.